My name is Dr. Modupe Elegbute-Odunsi. Now, obviously, the question about the wide gap that there exists, particularly in this part of the world, for patients accessing care, the biggest one, obviously, is the lack of infrastructure that is required to treat these patients across the country. To date, there is not more than maybe one or even two comprehensive cancer centers. And from that, I mean that a center where patients can have all their care delivered. The other big thing is the availability of important treatments like radiotherapy. There are only 10 radiotherapy centers across the country, serving a population of over 200 million people, where we should have a minimum of 1,000 of these machines. There is not enough in terms of the skill set to make the diagnosis that is required to be able to inform the accurate treatment of these patients. And as important is the lack of awareness and a lack of access to prevention programs for the general population. Compared to the developed world, where public health systems occur, where they would contact these patients when a woman gets to 40, they will remind her to go and have a mammogram, and for men to go and have their tumor markers done, for people to have annual wellness checks, and just to have screening programs that are accessible to patients irrespective of their socioeconomic background or where they may live. We in the private sector work very closely with the public sector as well to provide these screening programs and to ensure that people begin to understand that cancer is curable, but it's important that these cancers are detected early, because early detection does save lives and improves outcomes. This is a day to be positive and a day to work together, all of us together, to ensure that we begin to put all these things in place. Thank you very much.